Symptoms usually asymptomatic, often discovered occasionally when taking physical examination or imagological examination for other disease. Some patients have the symptom of lower back pain on the affected side. It is often not caused by renal cysts directly. Large-sized renal cysts, especially when the renal cyst happen intracapsular hemorrhage and get an infection, the patients would have the uncomfortable feelings as the lower back pain obviously. For example, if the renal cyst oppressed the ureter or the neck of renal calcium, it would cause hydronephrosis and secondary infection. Then appears the symptom of lower back pain, fever, and urinary tract infection. Regular treatment therapies, surgery therapy, renal biopsy, conservative treatment. The advantage of our treatment mainly takes the treatment to inhibit the growth trend of cysts, to reduce the cyst fluid source, and to destroy the epithelial cells of the cysts, inhibit the secretion of cyst liquid, and stop the growing up of cysts, increase the excretion of cyst fluid, and the blood circulation and transparency of the surface of cysts, speed up the excretion of cyst fluid, make the cysts become retracted. Hello friends, here is the nephrologist online video and consultation of Beijing Tung Shin Tang Hospital of Traditional Chinese Medicine. I'm the host, and today we are lucky to have Professor Mo Yer joining us. Okay, welcome.
大家好，我们今天主要讲的题目是肾囊肿是个什么病？
Okay, today our topic is what is the renal cyst disease?
首先呢，我们要了解肾囊肿是个什么病。
And firstly, we need to make clear what is the renal cyst disease.
肾囊肿呢是成人肾脏最常见的一种结构异常，可以为单侧性和双侧性，一个或者是多个，直径一般都在2个毫米以上，也有的来讲呢，直径达到10个毫米以上的囊肿，多发于男性，随着年龄的增长，发病率会越来越高。单纯的肾囊肿一般没有症状。
The renal cysts are the most common renal structure abnormality in the kidney for adults. They can be unilateral or bilateral, one or more in quantity, and also generally about 2 centimeters in diameter. And also there are cysts that is more than 10 centimeters in diameter. Mostly in men, with the increase of age, the incidence is getting here and here, and the simple renal cysts generally have no symptom.
我们呢，一般临床上常见的囊肿中呢，就是大多数是单纯性肾囊肿，而遗传性肾囊肿性的疾病呢，占比例呢比较小，小于20岁的呢，几乎没有单纯性的肾囊肿。如果小于20岁的个体出现囊肿呢，要高度的怀疑肾上先天发育问题，或者是遗传性肾囊肿性疾病。随着年龄的增长，肾囊肿的发生率呢越来越高，30岁到40岁呢，这个之间呢，单纯性肾囊肿发病率呢达到10%，而且来讲呢，就是说，人们到了80岁时候呢，单纯性肾囊肿发生率呢可达到50%以上。单纯性肾囊肿多发生于男性，当囊肿压迫引起的血管闭塞呀，或者是尿路梗阻时呢，会出现相应的表现，有可能呢是肾功能严重影响，而导致的慢性肾功能不全，最终呢可能因此呢而发展到中末期肾脏病。
Most common clinically renal cysts are the simple renal cyst, and the proportion of hereditary renal cyst disease is relatively lesser. There are almost no simple renal cyst in people younger than 20, and if there is actually a cyst in an individual younger than 20 years old, it is highly suspected that the kidney has a congenital development problem or hereditary renal cystic disease. With the increase of age, the incidence of renal cyst is getting here and here, the incidence of simple renal cyst between 30 to 40 years old is about 10%. By the age of 80, the incidence of simple renal cyst is more than 50%. Simple renal cyst occurs mostly in men when cyst compression causes vascular occlusion and also the urinary tract obstruction. It may appear correspondingly, which may affect the renal function and also lead to the chronic renal insufficiency, which will eventually develop into the end stage renal disease.
单纯性的肾囊肿呢，一般没有症状。一旦临床表现时呢，主要表现为尿蛋白、尿血、血肌酐升高等症状。原来一直认为单纯性囊肿呢，并不影响肾功能，但对肾脏，就是有的时候我们做CT 检查，或者是影像分析显示，经年龄、性别、原发性肾脏病呢，就是说那个等，校正之后呢，有肾囊肿的患者呢，比无肾囊肿患者肌酐升高的水平呢要多，而且囊肿的数量越多，血肌酐水平呢越高。这一结果提示，单纯肾囊肿同样会对肾功能产生影响。
As to simple renal cyst is generally considered to have no symptom and once clinical manifestations are present, they mainly symptoms such as proteinuria, hematuria, and also the elevated serum creatinine. It has been thought that a simple cyst do not affect kidney function. However, imaging analysis of renal CT examination showed that the patients with renal cysts had a higher level of serum creatinine level than those with the renal cyst after adjusting for age, gender, primary kidney disease, and the greater the number of cysts, the serum creatinine level will be even higher. The higher the level will be, and this result will suggest that the simple renal cyst will also have an effect on the renal function.
其中呢，反复发作的右眼血尿、感染、大量尿蛋白、血压过早的升高和肾功能过早的下降，是肾囊肿预后不良的主要指征。那尿蛋白、尿血、尿肌酐升高是怎样引起的呢？因为单纯性肾囊肿来源于肾小管的稀释，因为各种不良的生活习惯使人体内外毒素在人体内的蓄积超过人体的抗炎能力，人体细胞的抗炎和自炎平衡呢不断的偏向了自炎，肾小管呢这个稀释内的内皮细胞呢感染或者是损伤，反复的刺激下发生的表型转化，异常的增生堵塞肾小管，进而呢发化成为的衬缕细胞，大量的分泌囊内液，使呢囊肿的不断的增大，压迫呢肾脏的固有细胞，血液里边的红细胞呢和血浆蛋白漏到尿液里面，形成了尿血和尿蛋白，出现了水肿、高血压、肾功能下降等临床表现，这就是发生了肾囊肿。
Recurrent episodes of gross hematuria, infection, large amount of urine protein, and also the high blood pressure, and also the early renal function decline are the main indications for poor prognosis of renal cyst. How is the urine protein and blood in the urine elevated serum creatinine level caused? Because the simple renal cyst is derived from the renal tubule in reticulum and also various bad habits. The toxins in the body will accumulate, and also when this exceeds the anti-inflammatory ability of the human body, the anti-inflammatory and also inflammatory balance of human cells will be consistently shifting to the inflammation. Epithelial cells in the renal tubules undergo phenotypic transformation and abnormal proliferation, occlusion of renal tubules, and also the transdifferentiation and repeated stimulation of the infection or injury. It becomes a cyst land cell and secretes a large amount of cystic fluid, which causes the cyst to become larger and larger, compressing and injuring the kidney's intrinsic cells. The blood cells and also the plasma protein will leak into the urine, forming the urine blood and also the urine protein, and also edema, hypertension, renal function decline. And the clinical manifestations like the kidney or the kidney cyst will start to occur.
这个中医认为呢，肾囊肿是由于先天肾气不足，湿热邪气呢入侵了肾络，交接不去，发展到自身自重的状态，产生了湿毒、热毒，进一步呢阻滞气血，产生了淤毒。热湿瘀合而为害，损伤了肾络，出现了尿中的泡沫增多，尿血、血压升高等临床症状。
The traditional Chinese medicine believes that the renal cyst disease is due to the deficiency of congenital kidney qi, which makes it easy for damp heart able inviting the kidney network and stay there. With time going on, further aggravation produces white and heart poison that further blocks the blood and also produces stasis. The combination of damp and heart forms poison, which directly damages the kidney. There are clinical symptoms such as increased foam in the urine, and also the blood in the urine, and also the elevated blood pressure.
好的，各位朋友，我们今天呢给大家讲的肾囊肿是个什么病。
Okay, my friend, this is what we talk about the kidney cyst, and we are telling about it today.
知道了这个肾囊肿的诊断后呢，那为什么会得肾囊肿呢？明天我们10节的课程当中呢，给各位朋友进行详细的讲解。因为只有知道了得病的原因，才有办法进行治疗。所以为什么会得肾囊肿呢？是治疗肾囊肿的关键。
Okay, knowing about the diagnosis, why people will get the kidney cyst tomorrow, our live course, we will give you a detailed explanation about this. Only by knowing the diagnosis can we better understand how to treat the disease. So next time we will talk about it in detail.
感谢朋友的收看，下次再见。
Okay, thanks for watching today, and we will see you next time. Okay, bye bye.